The CDC is warning about the potential of an mpox resurgence this summer and is urging people most at risk to get vaccinated. Chicago has reported around 20 new cases after infections had declined substantially since last year's outbreak. And joining us more to talk about this is CBS News correspondent Roxana Saberi. Roxana, thank you for joining us. First, let's talk about what mpox exactly is, because a lot of people are hearing that and thinking, what is that?
Yeah, so mpox is a virus that was formerly known as monkeypox, but the name has been changed because there was a stigma around monkeypox. And in Chicago, as you mentioned, there has been a recent outbreak. In the past month or so, since mid-April, there's been about 23 cases that have been reported. And about half of those have been fully vaccinated, as far as we know. And so that's why some health officials there are on alert. Actually, the Chicago Public Health Department has issued a public health alert. But let's put this in perspective. Last summer, there was an outbreak in the United States and internationally. And at the height of that outbreak in Chicago, they had maybe 143 cases in 1 week. So here we're talking about 23 cases over about a month.
So it's not especially concerning just yet.
Not just yet, but it has public health officials aware. And why they are concerned is that some of these people were vaccinated, so they're wondering, has the vaccine, the efficacy, has it reduced over time? Are people changing their behavior, whereas they were a bit more careful last summer, especially curbing some of their sexual behavior? Or have they let their guard down? Or is the virus mutating? So these are some of their concerns, but they do say, keep things in perspective. And it's not as bad as last summer, but the CDC is warning that, we need to stay aware. And they're actually saying we're very concerned that the rest of the country could see what Chicago is seeing. And especially with summer pride events coming up, they say that people need to have renewed efforts, especially vaccinate, because otherwise there could be a substantial risk of resurgence.
So if I recall sort of the first outbreak of mpox, part of the reason, I know we're talking about pride events, part of the reason that it was kind of in a particular communities is it didn't have anything to do with those communities per se. It's just that, whoever the first person was that was infected happened to be socializing it in one particular community. So it ended up that, especially there were pride events, that it sort of stayed in one community. I imagine that, like many viruses, some people are more vulnerable than others. Who are the more vulnerable people?
Yeah, so the CDC says the general public are not at risk, but the people who are at high risk, they say there's about 1.7 million people in the United States, and about a quarter of them have been fully vaccinated, which means they've gotten 2 doses of the Jynneos vaccine. And the people who are most at risk, they say, are men who have sex with men and transgender people, and people who might have been exposed through close skin-to-skin contact, including sex.
So I know we were talking about a big question now is what is the efficiency and the efficacy of this vaccine given this resurgence in cases with fully vaccinated people? What do we know about the efficacy, and is a booster needed for people who did get it last year?
So the CDC just came out with the results of 3 studies yesterday, and across these 3 studies, they found that the efficacy of the vaccine, if you've been fully vaccinated, is anywhere between 66 to 86%. So it's not foolproof, but doctors we've spoken to say it's definitely better than nothing. And as far as this booster goes, the CDC is still looking into whether it's necessary. They're looking at the duration of immunity for people who did get the vaccine to begin with. I spoke to this doctor at Northwestern Memorial Hospital in Chicago, and she said she gets asked about 5 times a day by people whether they should get the booster shot. And she says it's an urgent question that needs to be answered.
All right. Roxana, thank you very much.
You're welcome.